So this is a biceps repair done with a graft. Now, this patient waited a very long time to do this operation, primarily because he just wasn't happy with it. He didn't like the way it looked. A good way to explain this is that he actually felt less of a man, essentially because he didn't have his bicep. And, this is a psychological impact he had on it. He actually cried after he did his push-ups because for him, this was a mental block. For him, his strength was in his masculinity. And this is a carpenter, did it very awkwardly at work by lifting a metal heavy staircase. Really affected his mental health. Part of our role as physios is not necessarily injury management or any of that. It's reassurance. It's making sure that there's an outcome. So the second is basically around 13 to 14 weeks after surgery. Again, I made sure he's strong enough to do that. And then this is just last Tuesday when I saw him, and he's got very, very good movement. He's got, he started lifting 7.5 kilos on one side and lifting it to get his bicep pump going. And, probably the happiest I've ever seen him since I first met him. So let's talk about the psychological impact. What happens when you start doing these releases and these surgeries and stuff? Like, how does a patient in front of you then feel?
To be honest with you, first of all, they are very grateful. So after the operation, I mean, to us, it's a simple procedure. We do it on a weekly, so to say, basis. The patients come back with gratitude on what you have done to them, and you think, oh, hold on, I just repaired the tendon. It's not like I did a heart surgery on you, but still, because especially if that's their dominant hand, and nowadays, stress plays an important part in our way of living. Yeah. And having your arms functional, being able to perform your hobbies, being able to go to the gym, being able to unstress yourself, go out in the wild, drive your motorbike, all these things, they feel grateful about it, and they are ready to undertake big operations like the one that my friend Rupen did. As you can see, he has done a lazy S incision over the anterior aspect of the elbow. This is because Rupen, I know he doesn't do such a long incision, but because this was left for a long time and he had to use a allograph, he had to do extensive releases, mobilize the tendon, apply extra bits of tendon on top of it to secure it, nicely. On the next video you will see, which is the video of one of my colleagues, anesthesiologist. He had a much simpler repair, 4 weeks down the line, 2 small incisions. You can barely see any incision around there, to be honest with you, on his elbow. And he achieved within 6 weeks full movement with full strength back. So again, we need to stress that in this kind of injuries, tendon injuries, the more you leave it, the more tricky it is for the surgeon to deliver the optimum outcome to yourself.
Yeah.
And the bigger the chance of complication and the longer the recovery. But it's one of the procedures that have very good outcomes and gives pleasure both to ourselves and to the patients.
Absolutely.